Hello, this is Chukudum from the Seal Farms. I'm excited to be here with you again on another video. And this time we're going to be talking about vaccination. Vaccination is one of the key things we do in broiler production. As most of you know, my emphasis on some broiler production. That's not, even though many of the things I say here will apply to layer production, but I specifically concentrate on broiler production. So we're going to be talking about vaccination. What is vaccination? How do you vaccinate? What are the key things in vaccination? Vaccination is an area that's often misunderstood. And most people, I hate to say it, even vet doctors, don't really understand how to do vaccinations. So it's a critical area because if you don't get your vaccination right, you could be creating problems for your broilers instead of solving it. Let us start with what is vaccination. Vaccination is administering a dead or weakened pathogen to healthy birds in a regulated manner. And after the vaccination, your birds develop antibodies, which would be some kind of immunity to fight diseases if they're contracted. For instance, if you vaccinate against Newcastle disease, your birds will develop antibodies against Newcastle disease. So in a layman's time, the next time your birds contract Newcastle, they'll be prepared. The body will be able to resist it. Vaccination is an effective way to resist and prevent effects of any of these viral diseases. As you probably know, there's no treatment for any viral disease. All we can do is to prevent it. Now, one of the things you're going to hear about, which is it's kind of technical, sometimes may not really be much of importance to a farmer, but it's important to you to know that there are two types of vaccines. The first is a killed vaccine, and the second is a live vaccine. A live vaccine is use of altered or diluted microbes to produce long-lasting immunity, but your birds may develop some symptoms, which is often called vaccine reactions. Then you have the killed vaccines that do not produce vaccine reactions, but offer less protection, and you may require multiple vaccinations. Let's talk about things you need for vaccination, because there's some tools or equipment needed for vaccination. The first for every farmer is that you need at least 5 buckets. It's important. 2 of those buckets will have to be reserved just for vaccination. Why is this important? The detergents and disinfectants interfere with the efficacy of the vaccines. So it's very important that the bucket you use for vaccinations or the containers you use for vaccinations will not be used for anything else in the farm. It should not be used for bathing, it should not be used for washing clothes, for anything else. So if you have 5 buckets, you take 2 and put 2 away, except you bring them out only on the days of vaccination. In fact, you should write vaccination on them so that nobody else can use it for anything. You may have a butter, which is the butters are usually 150 liters or 350 liters. And the reason you need that is for two reasons. When you're raising when you're raising 200 broilers or more, you need a butter because the water you will need will be more than 20 liters. So that's one thing. And also, you need it to store boiled water. This is for another topic when we deal with issues of water and quality of water. You'll need a flask to transport your vaccines, either from the vet shop or from your house to your farm. You need clean containers, usually glass containers, so you can mix the vaccines. If you have to do eye drop, you have to mix it with vaccination water. You need eye drop bottles to use to do your eye drops, and you need a syringe. So if you're preparing for vaccination, you must make sure you have these items because your vaccination will not work well. Now, before we talk about vaccination, it's important for me to let you know that the key to having a disease-free farm is biosecurity. And it's a big word. Some people just throw it around. What's biosecurity? It's a simple thing. Biosecurity simply means you maintain basic health hygiene that you learned in elementary school. Wash your hands, wash your clothes, a clean farm. Don't let your farm to be dirty. Don't let strangers come into your farm. That's basically biosecurity in a nutshell. So all those things that you learned in elementary school, you keep to them, and that's the key to having a disease-free farm. Vaccination is only a tool. In other words, if you keep a dirty farm and you maintain a dirty litter and you don't use disinfectant to wash your drinkers and feeders, and all you do is vaccination, the vaccination may not work. You're overworking your birds. So remember that vaccination is only a tool to help you, not a 100% solution to all the problems. Now, the next issue you have to think about is what guarantees you have vaccination? Vaccination does not provide a 100% guarantee that the disease will be prevented. But from my experience, if done properly, there's a near 100% guarantee that with proper vaccinations, you will not have the diseases for which you have vaccinated your birds against. However, even if the disease occurs, what vaccination will do for you is to make sure that the severity of that disease is minimized. So you reduce and minimize the economic impact of disease on your birds. Now, vaccination of sick birds. You've heard of the mantra, do not vaccinate sick birds. And everybody says that, and it's true. But there are basically, you may not know this, but there are two exceptions to this. If you have laryngotracheitis and fowlpox, you can't vaccinate even when the birds are sick. Now, I'll tell you what I do in my personal practice. I've violated this rule in some instances with Newcastle and infectious bronchitis. If I notice coughing in my birds and I suspect the reason for the cough is Newcastle disease, I might still vaccinate them by eye drop, even though they have Newcastle disease. And I find that most times, if the cough is caused by Newcastle or infectious bronchitis, that the cough resolves. So I personally violate that on those conditions. The other thing that is important in vaccination is the storage of your vaccines. Taking proper care of vaccines is difficult in Nigeria, because of the power situation. But so for that reason, I don't advise you to buy vaccines that need more than 1 day at a time, unless you're buying the vaccine from a long distance source. In which case, what I suggest you do is put it in the flask in the fridge and put ice blocks. So if even the power goes out, at least the ice will keep the vaccines properly stored. Never freeze vaccines. You don't put vaccines in the freezers. You put them in the coolest part of your fridge. Sometimes when you do vaccinations, you get reactions. You get your birds will some kind of snaking sound, head shaking, or watery eyes. That's okay. It's only a way of the birds to tell you that the body is building immunity. And so you don't do anything except give them minor multivites and clean water and fresh air. Now, there are various ways of administering vaccines. You're familiar with drinking water. That's what most farmers do. We also have oral vaccination. We have eye drop vaccination. You have nasal drop. You have dipping the beak in vaccination solution. You have injection, intramuscular, and which is usually for layers. Very rare in broiler production. We have spraying in the air or spraying around over the beds. You have in novo administration, which is when you do vaccination by putting the vaccine in the eggs while the birds are in there. And then you have wound tip vaccination. Now, let's talk about type of vaccines for broilers. You have Marx, you have Newcastle vaccination, you have infectious bronchitis, you have infectious bursal disease, which is gumboro, commonly known as gumboro, and you have coccidiosis, which is the one most people are not familiar with. It's newer than the other ones, but it's very effective. And in fact, today I did a coccidiosis vaccination for my birds. So for layers, you have more vaccines. You have Marx, you have Newcastle disease, you have infectious bursal disease, which is again gumboro, you have infectious bronchitis, you have coccidiosis, you have vaccines for E. coli, fowlpox, cholera, coryza, mycoplasma, Kamarov, and the one they call the 3-in-1 vaccination. So most of these are done by some kind of muscular injections. So when I get my beds or in my practice, what I do is I have a strategy and I ask myself, in broiler production, the 99% of diseases I will ever have will be the following. One will be Newcastle disease, second will be infectious bronchitis, gumboro, coccidiosis, the other will be CRD. The other things I may have will be bronchitis, bacterial infection, E. coli, salmonellosis, fowl cholera or typhoid, or pylori. Now, these are all bacterial infections, or coryza, which is also caused by bacterial infection. The other problem I might have with paralysis. So what I do is I find an effective way to deal with all of this, and that's where vaccination comes in. So I know that Newcastle disease, I use vaccination to deal with that, so I don't have to worry about it. Infectious bronchitis, I vaccinate. I don't have to worry about it. Gumboro, I vaccinate. So I don't have to worry about it. Coccidiosis is the same thing. CRD, there's no vaccination for CRD. So the way I deal with it with good litter management, appropriate heating and ventilation, reduced density, and I try not to stress my beds as much as possible. And for the bacterial infections, the ones I mentioned, which is E. coli, salmonellosis, coryza, fowl cholera, typhoid, pylori, all I do is I give them clean water. For the first 21 days, I boil their water, so I make sure there's no bacterial infection in the water. And then I keep a good litter management at all times. Litter management, we'll have a video also on litter management, is a key to healthy birds. Most farmers ignore it, but you're going to find out as we talk more, some of the vaccinations, if you don't do good litter management, it will not be effective. So your litter management is key to everything you do in broiler production. One of the important things in vaccination is you have to keep good records. You have to know the name of the vaccine, the lot number, the manufacturer, the production date, expiration date, and which of the chickens is receiving what vaccines. You keep this record in case there's a problem down the road. You can review your records to find out what happened. Now, there's proper vaccination for broilers. The first is, the vaccination has to do with how do you give, what type of vaccine do you give, how do you give, how to measure the water needed, especially because most of us do vaccination by water. How to measure the amount of water is key. If you put too much water, it will not be effective. If you put little water, just a few birds will consume all the vaccine. The others will not be vaccinated. So getting the right amount of water and starving them for the right amount of time is key to proper vaccination. So the first is Marx. Let's talk about Marx. Marx is, for broiler production, you don't talk about Marx that much because the vaccination is done at the hatchery. But it's important to you for you to know, because a lot of times when you have paralysis in your birds, it's a result of failure to do Marx vaccination properly in the hatchery, or Newcastle disease or bacterial infection. Most of you think it's calcium. No, most times you have paralysis. Marx may be the reason for that. So it's important where you buy your day-old chicks from. It's very important. The second is Newcastle. What I do is I give them Newcastle I do lasota vaccination for Newcastle by eye drop on day one. The reason I do that is because Newcastle is endemic. It's everywhere in our society, especially in Nigeria. It's everywhere. It's the most common. It's the first to attack your birds. If you don't do day one and you do day 14, like I've seen some people suggest, by day 14, it's likely your birds have already contracted Newcastle disease. That's why you have all those watery green pool. So the first thing I do is I give them vaccination day one. Now the reason you do eye drop is when you do vaccination by eye drop, your birds start to build immunity from day one. If you use water to give them vaccination, it takes 7 days for them to start building immunity. So if you give vaccination by water, say on day 14, they will not start building immunity until day 21. And I can almost guarantee you that your birds will have come down with Newcastle disease by then. So the preference is to give vaccination by eye drop day one, so that the birds have to build immunity. I also give vaccination for Newcastle disease on day 10, day 21, day 35, and day 47. I've noticed, and this is not in any literature, but I've noticed that most of the health people who have healthy birds vaccinate for Newcastle very well and vaccinate every 2 weeks. For a number of reasons I don't want to get into, the quality of the vaccines we have here is very poor. So, enough said. Let me say something as I'm talking about Newcastle, vaccination for Newcastle disease, for those who are raising turkey. Most of the mortality you have in turkey production will be from Newcastle disease. Most of it. Fowlpox is another disease that will affect your turkey, but you find that fowlpox does not usually kill turkeys. It will give them some irritation and discomfort. But most of the paralysis you have and the mortalities will come from Newcastle. Is of utmost importance that you vaccinate every 2 weeks your turkeys. Now, the next disease you can vaccinate for is coccidiosis. Coccidiosis is the most problematic disease in broiler production for a number of reasons. The first is that when you have coccidiosis, you may not even know you have coccidiosis. It's true, everybody knows when you see red poo or you see red or blood in your chicken's poo, you know you have coccidiosis. The problem is that by the time you see the red poo or the blood in your poo, on the blood in the poo of your birds, you realize that's the end stage of coccidiosis. 2-3 days from the time you see that red blood, you start having mortalities. So if you're waiting to see blood in their poo before you don't have coccidiosis, you waited too late. The first way to know you have coccidiosis is that your birds are not doing well when it comes to weight. That's why you have to weigh your birds every week. Okay. If you're in broiler production, you must weigh your birds every week. You cannot wait till the 5th week to start weighing them. And so if you weigh in the 2nd week and your birds are supposed to have a certain range when it comes to weight, and it's not in that range, that's the first sign that you have coccidiosis. Actually, for everybody who is raising broilers in deep litter, in the way we raise them, pack them up in the pen, everybody who is doing that practice, deep litter practice, you have coccidiosis. How severe it is a different matter. But as for whether you have coccidiosis, you have it. So do not wait for them to start dying or for blood in their poo for you to realize you have coccidiosis. Now, the other thing I have to tell you is when you give coccidiosis vaccination, you cannot remove their litter for the first 30 days. You can add to that litter. As you expand your house, you can spread the litter you have, unless you have a spot that is caked or dirty or wet. You must leave your litter for the first 30 days. And the simple reason is that to achieve immunity, the odds must be injected by the birds, so they have to pick it from the litter. And as it goes through the process called sporulating. And so your birds keep ingesting them, and as they ingest them and they excrete and ingest and excrete, you develop immunity. That's just a simple way of explaining it. There's more technical ways to explain it. So even with vaccination, you still have to do proper litter management for your birds. And if you give coccidiosis vaccine and you remove the litter within 30 days, it will not be effective. The second thing about coccidiosis vaccine is when you give it, do not give any other coccidiosis drugs to your birds, especially for the first 14 days. Because if you do, that will negate everything you've done, destroys the vaccine. So you have to be careful about this. Now, there are various brands of coccidiosis vaccines. I usually do not mention brands, and I won't mention the other ones I've used I didn't find effective. But I have to tell you that there's one particular one that's fairly new that I find very effective and I use it. And the name of that is Cociplat. And I use it today. It's very effective. So I'll suggest that to you. And to find out, you give that to your birds on day 3 by feed. You mix feed with the vaccine and the dye and the injection water. There's a process. You can learn that from your pharmacist. Now, some farmers will tell you that the coccidiosis vaccine is expensive. Well, I don't think so. It's true that the upfront cost may sound prohibitive, but when you count the cost of coccidiosis drugs, and you also count the economic loss from having coccidiosis and the mortalities from having coccidiosis, I can tell you it's cheaper to get the vaccine because you get the benefit of immunity from day one and you get very good growth in your birds. Remember, when you raise broilers, you're talking about 5 to 8 weeks. You do not have 1 week to lose to sickness. You don't have that luxury. If you're doing layers, yes, you may have a luxury of 1 week or 2 weeks. Your birds may recover. But if you're raising broilers and you lose 1 week to sickness, that's not good. So in summary, I've told you the days you do Newcastle disease. I've told you you do coccidiosis vaccine on day 3. It's a one-time vaccination. The other vaccination is for gumboro. I do gumboro for reasons I don't have time to get into now. I do gumboro on days 12 and 19. 2 times. You give the first one on day 12 and you give a booster on day 19. There are a couple of things I want to say about gumboro. Gumboro is the deadliest of all the diseases in poultry production because gumboro can kill 50% of your birds in 3 days. And if you know anything about gumboro, it only kills within 3 days. But all the damage will be done in 3 days. It attacks the nervous system, they will die. And so if you have gumboro, nobody needs to tell you have gumboro. You will know because they will die in front of you. They will come in, they look like they're drunk. Your birds will look like they're drunk. And the next thing, they'll just be falling and die in front of you. The only thing you know that it's gumboro, they also have a white poo. And so it's the deadliest of all the diseases, but it's the easiest to vaccinate against and it's the most difficult to contract. In fact, in all the years I've done this business, I've only had gumboro once. And that was when I was starting organic production and somebody told me I didn't have to do vaccination. Well, I lost 50% of my birds in 3 days. And I lost more than 2 million naira. So take your gumboro vaccination seriously. Two more things about gumboro vaccination. Do not give gumboro vaccination after day 28. You're supposed to give it before day 28. So the 2 times you have to vaccinate, make sure you do it within the 28 days. And the other thing I want to tell you about gumboro vaccination is the second dose must come within 10 days of the first dose. So if you give the first dose on day 12, the second dose must come before the 22nd. I do mine on the 19th. You can do it any day you want within that 10 days. But it's not as effective if you do it after 10 days of the first dose. Let us talk about the proper vaccination techniques. First of all, if you are doing lasota, I suggest instead of just doing vaccination for Newcastle disease alone, that you use lasota IB. Lasota IB will be for both Newcastle disease and infectious bronchitis. So it's like you kill 2 birds with 1 stone. Details of the coccidiosis vaccination I'll prefer to deal in the video dealing with coccidiosis because this video is already long enough. For gumboro, you simply do the similar way to lasota, except when it comes to dosage. If you have 100 birds, you buy 100 doses for gumboro. If you have 100 birds, you buy 200 doses for lasota, because for lasota, it's preferable to just get a double dose for that. I have to now deal with the issue of dosage versus amount of water because I get this debate all the time. Some people confuse the issue of dosage and the issue of amount of water. Dosage is based on the number of birds you have, pure and simple. So the dosage remains the same throughout the life of the birds. But the amount of water needed increases with age. So the water you use when they were day 10 It's not the same amount of water you use at day 40. So there's a formula for calculating the amount of water needed, and I'll tell you what the formula is. If the birds are less than 19 days old, the formula will be the age of the birds in days times the number of birds times 1.5 divided by 1,000. Whatever you get will be the amount of liters. You can approximate to the next highest number. For instance, if you get 7.6, you can approximate 8 liters. Then to that 8 liters of water, you add at least 16 grams of skim milk. And the reason we use skim milk when we do vaccination is because the skim milk helps to purify the water, clean it of any effects from chlorine. As you well know, you don't use chlorinated water for vaccination because it interferes with the vaccine. So the skim milk is for you to purify the water, clean the water, make sure that there's no chlorine in the water. And of course, you have to know that you have to leave the skim milk for at least 15 to 30 minutes at least for it to be able to do the work. Now, so that's the formula for day 19 and less. So day 1 to day 19, you use that formula. If your birds are older than 19 days, you use this formula. Age of the birds in days times the number of birds times 2 divided by 1,000. So whatever it gives you, again, you round up to the next liter, you multiply that liter times 2, give you an amount of milk to use. So again, as I said, the older the birds, the more water they need, but the dosage remains the same. How do we vaccinate? Let's talk about how to vaccinate this, because I assume most farmers are giving through water. You've measured the amount of water needed for the birds. You put in your milk. It's been 30 minutes. You've starved them of water. So it's now 2.5 hours, 2.5 hours, 3 hours, depending on the weather. It's now time to mix your vaccine. So you bring your vaccine in a flask. You take the vaccine out. You open the vaccine inside the water. You don't open the vaccine outside because the vapor is part of the vaccine. So you don't open the vapor outside. Besides, when you open it outside, the vaccine tends to draw in impurities from the air. So you open the vaccine in the water, okay? And then you mix it in the water thoroughly and you give to the birds. You get extra drinkers. If you're using 10 drinkers normally for the birds, you have 20 drinkers. You get the drinkers out, you start pouring for them. They will rush the water because they're starving. What you do is you don't disturb the birds, let them rush. After the initial rush, you notice some liquid is still remaining. So you go around and push the ones on the sides to come and drink. Within 45 minutes to 1 hour, they would have consumed all of the vaccines. Now, let's talk about the reason for vaccine failure. Sometimes you have vaccine failures, and I'll give you the reasons why that will happen. The first one is you are using expired vaccine. If you're using expired vaccine, of course, it's no longer good. The second one is that you have poor handling, either on your part or on the part of the people who had the chain of distribution before it got to you. Someone failed to maintain cold chain, or you're using wrong techniques. So that's another reason for you to have vaccine failure. The third reason is improper vaccine schedule. Sometimes if you give vaccine, for instance, you don't give vaccine before day 7 by water because the birds are not consuming enough water there. So if you use the wrong techniques, you may have vaccine failure. There's also what is called immune suppression. Now, sometimes you have infectious agents, you have nutrition deficiencies, you have lack of biosecurity, you have management failures, a combination of the above. For some reason, their birds are not in the optimal condition, so you might have vaccine failure. You also have the issues of maternal antibodies and maternal immunity. It's a very complicated matter, but sometimes that's an issue we cannot deal with right now, but it's an issue. The other thing that can lead to vaccine failure is stress. If your birds are really stressed, you could have immune suppression. Management practices, another reason. Poor litter management could also lead to vaccine failure. You're using the wrong techniques. That's another one. Instead of injection, you're giving water. Instead of water, you're giving injection. So using the wrong method for the vaccine is another reason. The ninth reason is improper dosage. You have 200 beds and using 100 doses. It will not work. Now, the other issue that comes up is the issue of vaccination, whether vaccination is allowed in organic production. Vaccination is allowed in organic production. Vaccination is not a drug. If you study other countries that do organic production, actual vaccination is encouraged instead of in place of antibiotics. So in summary, this is what you have in summary in terms of schedule. For lasota, IB, for Newcastle disease and infectious bronchitis, you give day 1 by eye drop, days 10, 21, 35, and 47 by water. You give gumboro days 12 and 19 by water. You give coccidiosis through the feed by mixing the vaccine in the feed. Again, the details of this we'll have in the video for coccidiosis. Thank you. If you have gained from this video, please subscribe and share.